So I've been asked to provide a little historical background to the issue of decolonization of global health, and so to talk a little bit about, I guess, the colonization of global health. So I've titled my talk Colonial Entanglements because early efforts by colonial powers to improve the health of colonized peoples living in Africa, Asia, and parts of Latin America were linked to and laid the basis for many of the ideas and practices of early international health organizations. These legacies of colonial medicine, moreover, continue to influence global health today. So this map appeared in a report of a conference that was held in Cape Town in 1932, in Cape Town, South Africa in 1932. Representatives of several African colonial territories, British India, the League of Nations Health Organization, and the Rockefeller Foundation attended the meeting. The map shows air routes that crisscrossed the continent and connected Africa to other parts of the globe. The map was presented because it highlighted the potential threat of air travel to the spread of yellow fever, a primary concern of the Cape Town Conference. Yet the map was significant in another way. Colonial medical authorities and representatives of early international health organizations traveled along these routes, collaborating in efforts to control sleeping sickness, malaria, hookworm, and yellow fever. They engaged in international meetings like the 1932 Cape Town Conference and consulted with one another. They published articles in the same scientific journals and formed complex research networks that stretched across the globe. Colonial officials moved back and forth, serving at various times in colonial administrations and then in international health organizations and back again. Most importantly, the early interventions of international health organizations were developed within colonial settings and to a significant degree were dependent on the coercive force of colonial rule. These interventions were also shaped by colonial ideas about the pathology of native populations and the inability of colonial peoples to improve their own health. All of these linkages contributed to the entanglement of colonial medicine and international health and shaped the subsequent development of international health efforts. If we are to understand the early history of international health, we must start with colonial beginnings. Colonial officials were concerned primarily with preventing disease outbreaks that would threaten Europeans and the economic base of colonial holdings by disabling colonial workers. Disease prevention often took the form of large-scale disease campaigns like the sleeping sickness campaign shown here from the Cameroon in 1933. The campaigns involved immunizations, vector control measures, or the treatment of infected individuals. Colonial health authorities also organized quarantine procedures when needed to prevent the introduction and spread of diseases. In some cases, disease prevention led to the institution of sanitary measures, particularly in urban areas. Both quarantine and sanitary measures were often enforced unequally, targeting colonized populations who were viewed by Europeans as sources of infection. These measures, as we'll see in the Philippines, could adversely affect the economic and social lives of colonized peoples. All of these activities were conducted through top-down programs designed by colonial health authorities with little or no involvement or accountability to local populations. Moreover, they were backed by the coercive force of colonial administrations. Finally, little attention was paid to providing basic health services or addressing the social determinants of health. To the contrary, colonial social and economic policies often undermined health conditions.